what we're excited about talking today is the political economy of when there are cases when scaling up works well in fragile settings, what are some of the factors? What are some of the underlying dynamics of the political economy that allows for those cases to work well? And so I'm going to take a moment at the outset to introduce our two speakers today, but then I want to run through what the run of show will be. So very, very pleased to have Alistair McKechnie, who is speaking to us currently in his role as Senior Fellow at ODI, but also has a long and illustrious career working on these very issues, including some work in Afghanistan that he'll be discussing and talking through. And then Pallavi Roy is a reader in political economy at SOAS at the University of London. And the work that she has done over her career is looking at these same issues with a particular lens on how to address institutional capacities to consider corruption and accountability issues. So the run of show for the day is Alistair will first give us a presentation or open a conversation on some of the work that was done in Afghanistan, and particularly in the health sector, and a really interesting and successful case of scaling up there. And then Pallavi will be discussing some of the work that she has done and is doing as we speak in Nigeria, calling in from Nigeria to open the discussion. So after those two presentations, that will be about 20 minutes each, we would invite members of the audience, the participants, to ask questions. And part of what we really like to do is, because it's a community practice, is we want to make sure that all of those who are part of this community have an open opportunity to raise questions, to discuss their own experiences and ideas about them. So after those two presentations, we'll open the floor for questions and look forward to hearing from those of you who have joined. So without further ado, I'd like to hand over the floor and the mic to Alistair to present his work on Afghanistan. Thanks.
Thank you very much, Rob. I'm waiting for the presentation. Here it comes. I'm Alistair McKechnie. I was the country director for Afghanistan from shortly after the 9/11 attacks in 2001 until the middle of 2008. I also, in parallel, was the regional operations director in the World Bank for South Asia. And since retiring from the World Bank, I've worked part-time with ODI, a think tank in London, and I really haven't had much to do with Afghanistan until about 2 years ago, when the national government fell, the Taliban took over again, and we did a number of studies on how the international community should engage. And I'll refer briefly to some of that work at the end of the presentation. I also should declare that I am not a public health expert. I was actually originally an energy economist that somehow drifted into management at the World Bank. So if you have a detailed public health type questions, I would refer you to some of the literature that's referenced at the end of the presentation. I'd also mention that while this presentation is about health, it could also apply to other sectors. It's really, the approach really is multi-sectoral. So let's start at the initial conditions in Afghanistan in 2002, when most of us were visiting the country for the first time, although some people round about my age had backpacked across the country in the 1970s. And what we saw there really showed the myth of many Afghans that this was a glorious age that somehow had been lost. Afghanistan always was a very poor country with institutions that struggled to deliver what they were doing. However, in 2002, the situation was really desperate. The country had been at war for 30 years. There was 3 years of drought, and there was a real risk of famine that concerned many of us in the international community. And public administration had almost collapsed. I mean, administration was not the Taliban's main interest at that time. Health indicators were truly awful, particularly maternal mortality, infant mortality, some of the lowest in the world. The Ministry of Public Health, like most ministries, was pretty non-functional, as the staff, particularly medical staff, had drifted away to NGOs and abroad. There'd been very low quality administration under the Taliban, and of course there was no direct funding and very little tax revenue coming through the budget. So the health services that existed were provided mainly by NGOs. They were humanitarian based and, meeting humanitarian priorities, and they were not really coordinated or part of any overall strategy for addressing the health problems of the country. They were also geographically scattered. There were underserved regions, and the service was really driven by NGO and donor priorities rather than some coherent national approach. And of course, you had all the problems of NGO funding that tended to be project-based, highly volatile, and really not planned, not intended to be short-term, even though these days most humanitarian crises are indeed prolonged crises. And that's a problem with the humanitarian financing system overall, something which ODI has done a lot of separate work on. Now, the international, I'm going to say circus, which it really was in a way, rolled into town early in 2000 and 2002. And there was a huge demand for quick action, quick impact projects, which Afghanistan's international partners thought were going to secure the peace. Whether they did or not, or whether they actually undermined it, we can debate. But this contrasted with the government, which at an international conference in April of 2002 really set out some clear strategic priorities and a demand for funding and coordination to take place through the national budget. This was largely ignored. Most of the donors, the international partners, the sort of people who take decisions in capitals, really had very little knowledge of Afghanistan. Donors assumed there was really no institutional capacity. They were starting from a blank sheet of paper, although, as Lakhdar Brahimi, the peace negotiator who actually put the Bonn agreement that led to the post-Taliban government, pointed out, the donors, nobody looked really very hard to find whether institutional capacity existed. There was a huge humanitarian surge. Remember, the country was at risk of famine, and the donor priorities were very much for women's health and for children. And of course, there was NGOs, and UN were scrambling to secure funding because there was a lot more funding available, and this built in incentives to overpromise. And that was a part of the political environment when the World Bank had to navigate. Everything was very short term, and there was no strategy for really what came next. Really, what was the health system in Afghanistan going to look like? How did you connect priorities, strategy, equitable access, health outcomes, and how do you get this at a national scale? Nobody was really thinking about this at all. It was all to rush in, do things quickly, and make sure that conflict didn't break out again, which was not necessarily a bad objective. Donors multiplied. I think the peak, there was something like 64 donors, financiers, and of course coordination problems got worse and worse. And we in the World Bank, we actually decided not to fund health or education in our first country strategy note to the board, much to the surprise of many people, as this clearly was a high priority. But these sectors were overfunded, they were driven by donors, chaotic. But the World Bank didn't walk away. It said, well, we could help the Ministry of Public Health if they wanted to come up with some plan for health service delivery, and we could fund any gaps. And we also established the Afghanistan Reconstruction Trust Fund. I believe its name's slightly different now, to pool and coordinate donor funding around national priorities across all sectors. Though this was expected to be small, the big partners, the US, the EU, and so on, they said, well, if some small donors want to put their money into this, that's fine, but we're going bilaterally. So this struggled on for about a year, and then the government really came back to the World Bank and said, look, help us come up with a coherent strategic program for providing a package of basic health services. They said basic health was the real priority. There's a lot of money available for hospitals and other things, and this was really where health interventions would impact the maximum number of people. And the country at that time, of course, was quite rural. So the first thing was to establish an architecture for the national health system, and they came up with a model, essentially public finance and non-state service delivery. And this was on a program approach. It was a multi-year comprehensive program, not a lot of little projects by projects. And it really had a national vision for scale to get coverage of all 365 districts in the 30 provinces of the country. The role of the Ministry of Public Health was redefined as a steward of the health service rather than as a provider of health services, and that was a very important part of the approach, because the ministry simply didn't have the capacity to do everything. The third plank of this was to build on the existing capacity of NGOs. I mean, the NGOs were providing services in the country. They had the resources, the people, the premises to deliver. However, the innovation was to have NGO franchises for each of the 30 provinces, so that one NGO would bid to have a franchise to deliver health services in a particular province. Now, one of the interesting parts of that was how to award these, and being the World Bank, essentially handing out money to people indiscriminately didn't sort of sit very well. So anyway, decided to do these, to bid out these franchises competitively, and this approach was actually based on cross country and cross sector learning. In other words, they're drawing from experiences in other countries. I think it was Cambodia where it had been successful, and also building on the expertise in how to structure competitive processes that was being pioneered in the infrastructure sector. So price was a major factor, but at the same time, somebody who had a post office box in Waziristan, couldn't bid. There had to be some proof, some demonstration that the NGO bidder was bona fide and competent of doing the work. There was also a model for long-term funding. It was clear that the government couldn't fund the service in the short term, but the program was designed to have the costs fairly low, around about $4 per capita per year, so that you're talking of $200–300 million to finance the program for the whole country, which was certainly affordable given the forecasts for the government budget that were taking place. And the last plank, which is a very important one, is the system of, if you like, third-party monitoring. This is the health inputs, the money and resources going in, the outputs, how many patient visits and things like that, health outcomes like infant mortality, and there are also surveys to say how satisfied were people who were using the services, were they treated with respect, on time, and so on. So all this was set up initially as a third-party approach using Johns Hopkins University, and there's a paper by some of the people who were involved in that in the references to this at the back. And it was also measured in real time. The data was coming in all the time, which enabled adaptive management, adjusting the program if necessary as the information came in, and also contestability among NGOs. So you could actually compare the performance of NGOs in different provinces, adjusting for things like income level, security, and so on. And there was also, I think, the other point, the second red thing, there was a issue of we had to deliver short-term results because, I mean, Keynes said in the long term we're all dead, and literally in Afghanistan there were children dying from childhood diseases and so on, and we had to get some short-term results, which the international community and the government were demanding, but we also wanted to get to full scale pretty quickly, and we set a time frame of around about 5 years to get there. So that's really the basics of the program. Now, did it work? I think the answer to that question is yes, it really exceeded our expectation. I mean, there was a substantial fall in the under 5 mortality rate. The figures are on the table, and when the guy who's running this program in the World Bank said, the numbers you see them on the table, and well, that's very interesting, but what does it really mean? And I said, how many children's lives does this was saved each year? And they came up with a number like 80,000, which we then presented to President Karzai, and he used this in every speech. He wanted to give us all medals, which of course we were not allowed to accept, and so on. So that was important. Donors were very skeptical, and I'll talk more about this later, this whole approach. But then when they saw the results, the skepticism changed to support. So you then had the money starting to flow through the ARTF, which actually helped the program scale up. So the World Bank money was essentially seed money for a wider effort, and the ARTF platform also strengthened coordination around government leadership, government priorities, and its budget. And then I think the other part of this is the success in the health sector also reinforced the support for other national programs that were being tried in other sectors which had similar scaling up impacts. Okay, so let's move on to the political economy of getting to scale, how we got there. And these pictures, I just throw them up because they have some importance. One is this first picture of the women in the burqas on the maternal health education. There was a strong emphasis on prevention, on stopping people getting sick and into clinics in the first place. So there was also an outreach associated with. The lady there is a very interesting woman who was the Minister of Public Health. She was a lieutenant general in the Soviet Afghan army. She did not speak English. I think she spoke very good Russian, though I'm afraid I couldn't assess that. And she really was not the typical type of champion one sees. Somebody who speaks English, educated at Western universities, who's really familiar with the concept, but she had very strong leadership skills, vision, imagination, and I was very impressed by the way in which she led this program, and unfortunately she died in 2004 due to complications of COVID. And unusually for a health minister too, she was a chain smoker, which I thought was rather odd. And then I think in terms of building up support within the World Bank, and we were very interested in getting senior managers. This was Graham Weeder, managing director number 2 in the World Bank, visiting a clinic, and that also helped to build support within the organization. Now, how do we navigate the Minister of the political economy? Well, there are a number of stakeholders, and they all had interests. And how could we do things that resonated with their interests? So starting with the Ministry of Public Health, I mentioned you had this reformist, unconventional minister who was supported by 2 technocratic deputy ministers from the diaspora, and they drove the program day to day, and they made sure the minister was well briefed in Dari, and she also was an advocate within the government. Now, the ministry staff, many of whom thought they were going to get into the service delivery mode, were a potential issue. And of the 30 provincial franchises, 2 were set aside for the ministry, but under the same terms as the NGOs. In other words, the medical staff working there could be qualified for higher salaries. They would have the same financial arrangements as the NGOs, and basically would compete on the same terms. As it turned out, the 2 provincial franchises performed about as well as the NGOs, which was interesting. However, what we've seen in other countries, I think it was Pakistan and Liberia, is when the NGOs disappear, were pushed out as part of government policy, the performance of the ministries, the public sector, deteriorated. So this contestability, we've got to do really well, other the NGOs are going to come in and replace us, was quite important. There was also a parallel civil service reform going on, which enabled professional staff to qualify for new higher paid roles. This civil service reform had mixed success. I'll be frank about that, but that part of it was quite important. The procurement was under World Bank rules and monitoring, which reduced opportunities for rent seeking. Corruption over pharmaceutical procurement, clinics selling medicine to private pharmacies, and that it's a problem throughout the world, was something we were concerned about. And also, what we were looking for was is the early results, the trying to embed the change as permanently as possible and build broad support, enable this approach to survive change as a minister. I mean, the next minister after General Sahela was an ex-WHO person, is good, but instinctively he might not have adopted this project if it hadn't been so well entrenched. Now, the rest of the government, the president liked it because of the 80,000 children's lives saved. It's interesting. I really don't know. This is pure speculation. But his wife was a pediatrician, and he had 3 children when he was in office. So I suspect he would be inherently sympathetic to what the program was trying to achieve. Health is also inherently technocratic. You don't want your doctor to have got there because of political patronage. So I think the risk of patronage are probably lower in health than in some other sectors. The finance ministry was an enthusiastic supporter. It wanted national programs, not hundreds of tiny projects. It liked pooling of funds and better donor coordination, which it was responsible for, and it liked the financial sustainability. And then on the other parts of the government, there was a huge backlash against the UN and the NGOs operating as a kind of parallel government, and the Afghans really wanted to assert their sovereignty, their national identity. So seeing the NGOs operating within an Afghan-led framework, I think also helped build support. Now, the Afghan people, they got better health services, and in return, they protected the facilities against possible damage by insurgents, because they really liked the services. Now, on the insurgents and warlords, there were limited opportunities for rent seeking, as I mentioned. This particularly by the warlords, though I won't state categorically that none took place. For example, vehicles traveling along certain roads, people could have demanded money and did. We knew about that later. The Taliban were wary of interfering with programs which had strong local support. This was particularly so in education, where the schools under the government's national program were not burned down, whereas bilateral ones often were. Health services were available to all local residents, so if some young man turned up at hospital with shrapnel in him, then I guess he was treated. But nevertheless, where insecurity increased, the results went down, and sometimes in some areas, this program could be seen as a government program, as a foreign-run program, and so on. So it was a mixed picture in some regions. The international partners was interesting, because that's where a lot of the real political economy problems lay. First, there was some really strong opposition. There was a joint letter by 3 major donors, and these donors were actually almost in a dispute with each other. You remember the Freedom Fries episode in the US, but nevertheless, countries that were arguing about each other got together, wrote a joint letter to us, complaining about experimenting with Afghans, the need for sticking to proven approaches to keep the peace, and so on and so forth. Now, it's interesting that the signatories of this letter now claim that this program was theirs, that they thought of it. That's fine. We're interested in the health of Afghan. I think some of the donor staff were worried about their loss of their role and the power, having your own project mentality. One major multilateral tried to get the World Bank to fire its project leader because of a perceived insult. This guy said, our man said that the health of Afghans would never improve while this person was in the country. He was actually out of the country at the time. It was some kind of crude joke, which backfired. But nevertheless, we supported our person, and I had to, grovel to the person and say that we really didn't intend to insult them. As I mentioned, the other partners came on board and started financing it. But I think what the critical factor was, the strong support from a sovereign government brought the partners into line. I mean, if you have a government to say, this is really what we want, then we will do it. And after we had the letter, I went to the minister, the lady we saw, and had a one-on-one meeting with her. I said, is this something you really want? I mean, our staff can sometimes be over-enthusiastic, blah, blah, blah. And she said, yes, this is absolutely what we want. It's the bilateral approach is what we don't want. And I came back from that feeling quite satisfied that we were on the right track, and that the government would make their views known, and the rest of the international partners would slowly get on board. So if you don't have that strong government leadership, then it's much more difficult, and that's something we might discuss later. NGOs, well, they were apprehensive at first, but then they realized that the health problems in Afghanistan are so enormous, there's more than enough work for everybody. Secondly, they saw the advantage of predictable, secure, multi-year funding. And those of you of us really who work in NGOs know the problems of getting funding for programs rather than fairly short-term projects. The contracts were renewable if the performance was adequate, and this also created more confidence in the system. There was an incentive to work to localize with Afghan staff. Because cost was a factor in awarding the contracts, then the NGO managers had to decide how rapidly can we can we scale up employment of Afghans, given that we also have, fiduciary, quality, and other obligations to meet. So that was an interesting part of the dynamic. However, as I mentioned in the panel to the left, rising insecurity led scaling back in some regions. There were places where NGOs didn't want to work, and we could see this. And this is from one of the World Bank reports. This graph here shows the output patients per capita. So we're getting up close to one visit per capita per year in this province of Saripul, which is in the northwest of Afghanistan, an area which was relatively secure. And down here we have Helmand. Now you see in the first year, it wasn't bad. It wasn't as good as Saripul, but still the visits went up by 30% in 1 year. And I seem to remember that the number of pregnant women visiting a clinic went from 4 to 40% in Helmand. And Helmand is a very socially conservative area. Now, there was a Taliban offensive in 2006, a major offensive, and basically the government and its allies, so British and Americans, lost the battle. Something I didn't really know about at the time, but I learned about it in Malkasian's excellent book. And you can see once you had a fighting war going on, the quality of service tapered off and maybe even fell back, regressed a little bit. So security was an issue, and yet the military-based approaches to development through provincial reconstruction teams, not so much development for stabilization, they really failed to achieve both security and health results that weren't transient. And we spent quite a lot of time talking to NATO and trying to convince the generals, but it was one of these problems that remained unresolved. And I think one of the questions is, how do development actors interact with those responsible for security? The main slide here is really, how do we manage this political economy? I mentioned strong, effective leadership in the health ministry, but we have to reinforce it, not to replace it. So it's their program. We need to nurture their credibility to convince Afghan shareholders and international partners. And it's really much working with the grain, working with what's there. Building allies within the government was important to broaden and deepen support, including at the top levels of the government, the president himself. I can't stress enough the importance of some early results to build credibility. We didn't have time for a pilot. I mean, Afghan children would have died if we'd spent a year trying to fine-tune the approach. So we really tried to, what is the best global knowledge, the good practices that may be transferable to Afghanistan with some adjustment, and how do we use what exists, the existing in-country capacity, which was NGOs in this case, which lowers the risk of going to scale, and also began to convince stakeholders that the risks of failure were acceptable. So we needed to deliver early results. But nevertheless, early results have to be part of a long-term strategy. How does the system evolve to creating permanent institutional architecture and financial sustainability for service delivery in the country? And those links are really, really important. It's not just short-term alone, it's short-term as part of a coherent long-term strategy. There's no time for political economy analysis. I mean, I'd like to think that we did all this after very careful analysis of all the stakeholders and so forth that we mentioned in the previous slide. We didn't know much about this, quite frankly, and I don't think anybody else did, including the security and intelligence people. Judging on by what happened on the ground. Therefore, I mean, the quality of the staff you put into the field, particularly people with good facilitation skills, good judgment, and the ability to learn and adapt becomes critical. So staff quality is really important. It's also important that these staff have management support. And we managed to get this. We're lucky with the president of the World Bank we had at this time. And you have someone like the president, managing directors, vice presidents communicating the message. It broadens the support at high levels of the government, like the presidency, people that I didn't have, day-to-day contact with, and also among the senior representatives of the international partners, the ministers of foreign ministers, development ministers, and also the military. We had to, we could meet when my bosses came to town, we could meet the ISAF, the NATO commanders, the various generals as well, which they listened, but how much they heard, question mark. There was also a health consultative group, which I think were useful initially. My experiences of these consultative groups are not good. I mean, I always used to faithfully attend the relevant meetings for me, but I always found a lot of talk and not much decision making. But I think it helps to build consensus. The pooled funding arrangements, the trust fund, I think were really important to getting the money to achieve scale quickly, but it also creates a platform for problem solving and coordination. And coordination is much better when there's a budget constraint, i.e. there's a fixed amount of money available. How do we spend this money for the greatest development impact? And that focuses a lot of the discussion around coordination. There's also accountability, naming and shaming, who's doing what, and at the same time building trust among the partners. And I'd stress in this case, the trust fund was not just for the health sector, it was for all sectors. And I think this created a higher level of government, a high level of interest outside the Ministry of Public Health across the whole government, and also among the development partners. I mean, the ministers of development and finance and so on in the G7 and other partner countries. The health system monitoring, I think I mentioned before, was important. The benchmarking of NGO providers in particular, the ability to adjust the program as it unfolded. But I think also the links between the information generated by the health service, by the health system monitoring, and communications, being able to articulate the results, the successes to the rest of the world was important. And I think the final point is, nothing succeeds like success. I mean, if this had been a disastrous failure, it would never have got the scale, and it shouldn't have. I mean, somebody should have tried something else. On an epilogue, this program has continued. It had changed its name and was one of the last government, the Ashraf Ghani government's priority programs. It's interesting that the program has continued since the Taliban took over in August 2021. And I think this is probably one of the greatest tests of any program's resilience. It's still shown on the Ministry of Public Health website. The current Minister of Public Health is a medical practitioner, a urologist, and the ARTF, with the money it had available, its last health financing operation started in May 2022, which was after the August 21 takeover. However, the trust fund has received only $43 million in 2023, and there is a shortage of money that could derail things. The future, I think the program does depend on relations between Afghanistan and the international community, and this affects financing in particular and the ability of NGOs to operate. And as you know, Afghanistan is currently under international sanctions. There is some flexibility for humanitarian action, and we've been quite critical of these approaches at ODI. There was a window in 2021, 2022 that might have been able to be open, but it wasn't, and there is a real risk of regression to these conditions that we identified in 2002. And finally, I think the slides will be available, but we do have a bibliography that if anybody's interested in learning more on the program. Thank you very much.
Alistair, thank you so much for that really interesting presentation. For those of you who have been long-term members of this community of practice and looking at fragile states, you'll know, Alistair, that the case of how to scale up, the Afghanistan case of health sector scale up is often cited, and it's really a pleasure to have you speak a lot to your own personal experience with that as the person who was right in the middle of the World Bank's leadership, trying to put that together and to make it so that it worked. And I hope that in the discussion, we will be able to answer some of the questions that are coming through already. I'm going to hold, Alistair, those questions so that we can have Pallavi's discussion, and then maybe we can make sure we can make sure that both are presented, or that we can try to weave some of those together. I, as you can imagine, have some questions as well, but we'll make sure we give space to our participants. I want to make sure that we give the opportunity to Pallavi to speak about the really interesting work she's engaged in right now in Nigeria. So without further ado, over to you. And if you can keep it to 25 minutes, that would be great. Thanks, Pallavi.
Thanks, Trace. Thanks, Robert. Alistair, that was really fascinating, as always. And, while you were talking about how this is something that can actually be used multi-sectorally across geographies. I'm sitting here now in Nigeria, where the current health minister is really trying to bring down, maternal mortality rates and bring up neonatal rates. And this whole idea of a country platform and the way you went about it is something that would really work well here. But I will pick up on one of the points that you picked up there, which was on governance and corruption. And what I'm going to talk about in this presentation today is essentially about the fact that successful scaling is about introducing sustainability. It's about raising coping capacities, which is intrinsically linked to governance. And governance is at a premium in fragile contexts. And by fragile context here, Alistair spoke about Afghanistan, which was both conflict affected or post-conflict, but also conflict affected, even while these programs are going on, and certainly fragile, but fragile can also mean very vulnerable. And that is what I will be talking to in the case study that I'm presenting on Nigeria today. So this presentation is really going to be about how to introduce governance sustainability in fragile contexts where scaling is actually being attempted. Now, it's also based on the work that we are doing in the SOAS Anti-Corruption Evidence Program, which is essentially about how to implement governance policies, not in the sense of transparency and accountability, but linked much more to productive sector outcomes. So we're really doing anti-corruption in the productive sector, not so much about civil society, media, but working with organizations that are productive, that generate livelihood. So if you want anti-corruption policies that are embedded within sectoral policies. And this is the work that we are doing currently in Nigeria. In fact, I'm in Abuja now on fieldwork for this particular project that we are doing with SMEs. And it is, to my mind, a very interesting example of how you introduce elements of sustainability, how you bake in governance, taking into account the constraints that you have in fragile contexts, and you then make that anti-corruption and the scaling up efforts actually self-sustaining. And I'm going to explain those links to you in a while, but just to very quickly go to, from fragility to resilience. And have I moved? Yes, I think I have. Now, fragile contexts of obviously, especially weaker governance systems, there's rent capture, there's leakage and distributional contests because of the adverse distribution of power. And the adverse distribution of power is not always about authoritarian. It could be very fragmented distribution of power. It could be conflictual situations between powerful groups. whatever may it be, the distribution is such that governance as we want to see it in action is not what is essentially embedded in these kinds of contexts. So attempting to scale in such a context without considering these very structural drivers which come from a particular distribution of power is something that would be highly counterproductive. The coping capacities that one needs to exit these kinds of states of fragility might in fact be weakened. We don't take into consideration the existing governance problems. We rush in, and I do take on board what Alistair said. In a context like Afghanistan, which is conflict affected, you don't have the time. But in a slightly less, I would say, adverse context where you have vulnerabilities but not conflict affected, there is, to my mind, time to actually go and do a deeper dive into what the political economy and the governance constraints are, and then design better so that we don't actually, so that we ensure that the governance vulnerabilities don't persist. And that's important. That's important to why we say that the political economy factors are extremely important. So any attempt to scale programs, interventions, and operations in fragile contexts actually requires more enforcement capabilities. And this is an interesting paradox. You require higher enforcement capabilities. You actually don't have enforcement capabilities in these kinds of fragile contexts. And therefore, the response is usually to securitize. The response is usually to go, top down, what we call in our framing, vertical accountability. And I will explain the difference between vertical and horizontal accountability, which I'll come to in a bit, and horizontal enforcement in a bit. The response is, well, since we don't have enforcement and we need high levels of enforcement, let's throw whatever we can in terms of very formal top-down processes, including securitization, like we see, for instance, sometimes in this country's Niger Delta, and hope that we get the best outcome. And we generally have more rule following and less rule violation. But as I said, this can actually exacerbate the vulnerability. It can, set off a chain of counter pushes, which might not always lead to conflict, but certainly can lead to very high levels of illegality and violations of law. So scaling has to be essentially about keeping in mind the governance constraints that need to be understood, which we usually do. But what we don't do from there is also assess these governance constraints for feasibility. And that's a very important link that we need to make. And that any scaling effort has to recognize this, so that the scaling that the scaling that we are actually attempted has built in a response to these governance constraints. And I think that's our starting point. So the technical solution is one thing. How do you operationalize? Who are the project managers? What kind of technology that you build in? But what technology, on what governance mechanisms or constraints is that technology actually sitting on? And that interaction is very important to keep in mind. So yes, non-technical considerations needed, but which are the ones? So in fragile situations, there is one thing that we need to take to look out for, and that is the tendency to free ride. And this is the point that I'm making about vertical enforcement versus horizontal enforcement. Why is this tendency to free ride? Why is this so consequential when we are talking about fragile contexts? And this actually gets exacerbated in these. Free riding is something that we are faced with everywhere, but on a spectrum, the problem is actually deeper in these kinds of fragile contexts. And the reason is free riding. Some people are breaking rules for whatever reason, and others then jump onto this bandwagon and start breaking rules just because they can. So in this kind of context, where at one level we can say that there is no interest of anybody in that particular community or sector that we are actually targeting, if there is no interest to follow rules, however, whatever amount of top-down enforcement we do, introducing these vertical enforcement mechanisms, which tend to be vertical accountability mechanisms, aren't going to work, because people will find a way to work around. Or if at all vertical enforcement, it tends to be very selective. Whoever's more marginalized and more vulnerable in an already fragile situation actually has that vertical enforcement implemented upon. And that is the reason why we are actually looking for areas where a certain kind of peer-to-peer monitoring is actually present. And that's important for sustainability. Remember what I said about the free riding issue. If no one has an interest in rule following, however much of vertical accountability and vertical enforcement that you actually implement, you are not going to have the kind of rule following behavior that's necessary to build in the coping mechanism, to build in sustainable resilience over here when you're scaling. But if you have actors interested in rule following, if there is a demand for rule following, then it actually becomes easier for that particular scaling model to succeed. And this kind of interest and this kind of demand is even more important in fragile contexts, because you need to scale up fast and you need to scale this up effectively. We have actually very little room for redundancy here, very little room for making mistakes here. So central to this analysis in the SOAS ACE framework, as I said, is the approach of horizontal enforcement, where anti-corruption strategies include insiders, include identifying insiders with the incentive to follow rules and upholding rules in their sector for their own benefit. It's not just for a normative reason. I know we want rule following for normative reasons, but sometimes we actually want to push this also for reasons which are of benefit to others. And then the next step becomes that, yes, this becomes a norm and you want to actually be a rule follower for normative reasons. But first, in these contexts, we need to provide people the incentive to follow rules and provide them the benefit as to why rule following will actually work for them. And this is necessary because, as I said, it supports those vertical enforcement structures, which don't work when we have a free rider problem here. So without horizontal demands for enforcement, vertical enforcement is unlikely to discipline the powerful, politically connected players. Remember what I said about the adverse context. It's distribution of power. It's the fragmented, competing, conflictual, could even be authoritarian context of vulnerability. And in that situation, vertical accountability is not going to be working. So strengthening vertical enforcement, though, often happens to be the go-to solution here, but that is not what is going to lead us to results. And what is going to lead to results? And we have a particular way of mapping the political economy in these contexts. And we call it the power, capabilities, and interest approach. And it's a departure from the normal actor mapping, because in other kinds of actor-based mapping frameworks, we look at power and interest, and that's extremely important to look at. But in our framing, we also look at the capabilities of the actors on whom we want to implement a rule-following policy. Now, why would that be important? And that is important because if I'm capable, and remember I'm talking about productive sectors. In this case, I'm talking about the Nigerian SMEs, which I will talk to in a moment right now. Why is it that capabilities are important? If I'm productive, if I'm able to generate livelihood as an actor or an organization without breaking rules, which is I'm profitable, I'm providing employment, I'm actually producing an output that enhances a net social benefit. Well, in that case, rule following might even be to my benefit. So these are the actors that we are actually trying to identify in this case. So think about it this way. Through a PCI mapping, we are first, of course, looking at the relative power. We're looking at the relative power of those within that particular sector, so that an actor can actually hold out against another actor when it comes to any kinds of resource conflict. So that's the power aspect of it, which is always relative. We're not talking about absolute power here. It's relative to that particular context. There's interest, which depends on capabilities, which is productive or otherwise. And of course, the opportunities that we talked about, because if I'm capable, as I said, I will be interested in following rules. So one way of thinking about the PCI approach is essentially, you're not just looking for the rule breakers. You are looking for the rule followers. And this is even more important to do so because given that you're in a fragile, vulnerable context, in identifying the rule followers actually short circuits the process. You don't always look at the rule breakers, but you're looking at the rule followers, and then you're following up from there as to why are some people, even in such an adverse context, following the rules? What is the benefit in following rules? Why are they following the rules? And how is it being done? So taken together, by looking at the power, capabilities, and interests of people, we are actually able to define a certain kind of behavior, which is rule following or rule breaking. But in our framework, actually identifying the rule following behavior is much more important. So we arrive at an understanding of the organizations that are likely to engage in horizontal peer-to-peer checking. And that's important because, as I said, the vertical enforcement mechanisms are actually quite weak here. And that will support the enforcement of productivity enhancing rules. And I'll come to the SME example in a bit. So it's important to remember that contexts may be fragile, but they're usually not anarchic. And this methodology actually helps us identify why all resources are not captured and who are the actors that prevent this from happening. And then once we do that, we try and identify what kind of policy solutions can actually strengthen the hands of people, or if there are potentially productive actors and organizations who we feel can benefit from a certain policy intervention and will not break rules, then we go for identifying those kinds of actors. So that is extremely important for us to know. So how does PCI help identify this horizontal enforcement? I've already spoken about some of this. In some cases, actors with power, capabilities, and interest may already exist, and you incentivize them. So that's step one of our mapping as to who's following rules. In other cases, we've actually identified potential solutions, but the actors so far do not show any interest because a potential solution hasn't actually been presented to them. And that is the case that we've identified in our Nigeria case study. And in both cases, what ensures rule following and rule enforcement is the horizontal enforcement. Even where we see that the vertical enforcement is working, it is actually working because it's buttressed by the horizontal enforcement at one level. And where we see horizontal enforcement working, we try and see where we can strengthen the vertical enforcement, which is the formal policy design. And what is it that we saw about Nigeria? Now, the power sector in Nigeria can very well be defined as vulnerable. It's certainly not conflict afflicted, but this is a country of about 200 million people. This is going to be fourth most populous country in the world in a few years from now. But it is a country which has electricity supply that Nigerians themselves describe as sclerotic and painful. Transmission capacity hasn't gone up beyond about 6,000 to 8,000 megawatts. What distribution companies discharge regularly to consumers is not above 4,000 megawatts. You can imagine this is a dynamic country. It's an entrepreneurial country. SMEs form a very critical productive base, but they actually receive no more than 4 to 5 hours of power from the grid every day. As a result, what has happened in Nigeria is this country has one of the highest levels of what we call self-generation. SMEs, consumers, residential consumers, industrial consumers, commercial consumers use heavy-duty generators called listers, which normally run on very polluting diesel. And this is how they're actually coping. You obviously make do when there are such big supply constraints. And if you do a political economy mapping of the grid, so we move from the top to the bottom, because in this case it required this kind of a hierarchy of our mapping with the PCI approach. We looked at the top, we looked at the various powerful ministries, we looked at the powerful ministers, the senators, the National Assembly, various funding bodies, monitoring bodies, and there are deep anecdotal evidence of capture across all of this, so that what we ultimately get, I'm not going into what kind of capture that is, but what we ultimately get is a very, very adverse outcome of not providing this country and some of the consumers who need it the most with the kind of power that's required. Then we said, okay, let us look at what is happening at the level of consumption. Well, the residences certainly have interest, but do they have power to actually enforce on each other? They're too heterogeneous a mass. Even in welfare residents associations here, there are diverging interests, there are diverging levels of electricity usage. We're never going to get to a commonality. Commercial, they're already putting up small little solar, plug and play machines here and there. They've been able to look after themselves. Big industry, they're setting up the captive plants. They're practically dealing from the grid. Interestingly, a segment that we then saw was a constituency which was in breaking rules, but for very reasonable reasons. What do I mean by breaking rules here? They were not paying bills, their electricity bills. They were hooking, what's called directly taking from distribution lines. They were paying distribution company engineers to illegally get more power. They were buying diesel from the black market to fire up their generators. And remember, we are an anti-corruption evidence program, and I said that we are not looking for how to increase transparency and accountability with parallel programming. We're looking at how to actually increase self-enforcement by looking at what is available, what opportunities are available within the sector. And that is a self-sustaining mechanism. That is the increasing coping mechanism that I'm talking about in this particular context. So we looked at the SMEs and we saw that, yes, they are breaking rules. But if they had a solution provided to them where they are provided electricity at a cost that they're willing to pay for, then they have every incentive to not break rules, because this was the one segment which was actually beginning to lose productivity. This is an employment generating segment in Nigeria. They were actually shedding employee numbers. They were bringing down shifts because they couldn't manage without power. And diesel is becoming really expensive. This country has just been through a depreciation. But if there was some way of providing them with an electricity supply model where what they are paying in their mind rationalizes what they are getting, then they actually have an incentive to not be corrupt. But there was another very, very important insight here. In a lot of these cases, what you have is, in a lot of these cases elsewhere in the world, you do have willingness to pay studies. But what was important over here was, along with the willingness to pay study, what we also identified was where consumers, in this case the SMEs, are actually willing to monitor each other. That is to say, they were taking care of the free rider problem. I have an interest in ensuring that whoever supplies power to me, I actually pay that person back, because I want that power to run my machines, to run my 2 shifts that I haven't been able to run. And it's not only in my interest to pay my bill, which is my willingness to pay, it is also in my interest to check my neighbor. Is she or he paying her bill? Because if she doesn't, the supplier is not going to pay. And here we are talking about a disaggregated, de-linked supply solution, which is a hybrid, almost like a plug-and-play solar cum battery solution, where the grid isn't any longer playing a part because the grid is very dysfunctional. The grid isn't able to supply. So this SME now knows that his well-being depends on the other person paying his or her bill. So he's now going to monitor. So this is how we bake in that horizontal enforcement mechanism. We make this self-sustaining. So as I said, this is a way of identifying rule followers, not just the rule breakers. We know who the rule breakers are. Let's get them out. Why is the rule following happening? How might we actually deepen rule following? So this is what we are saying. And this also has an interesting element of economic de-risking, because for potential investors in power generation, this is my last point here, the risk is reduced because not only have we established willingness to pay, the potential power supplier, who really doesn't want to take on the hassle of monitoring and overseeing, knows that there is this built-in mechanism where SME 1 is checking SME 2, is checking SME 3 to ensure that bills are paid. So I know this is a de-risked model. So finding private financing actually becomes easier in that case. And this was also, an example of methodological scaling. In one sense, it was an adaptive pathway. We started in the southeast of Nigeria, which is really the beating heart of Nigeria's SME sector, and we came up with a proof of concept. Then we moved closer to a very large SME cluster in Abuja, in a place called Kubo, which is a very important consequential cluster which supplies to the construction market in Abuja and to a neighboring state called Nasarawa. And what we then thought we would do was we take this proof of concept, we'd actually go and conduct an infrastructure audit. We would conduct an energy demand audit across the SMEs within the cluster and show these SMEs that, look, we've conducted this audit. This is what you're actually paying for self-generation, because you're paying for the diesel, you're paying for operations and maintenance, and you're paying for costs of corruption, all the bribing that they have to do, which they don't normally compute as cost of generation. But this is included in the cost. And we thought this modeling would convince them. But you do realize that there is a huge slip between what you think will happen, you plan for, and you actually go there and talk to them. And we've spent days on the field talking to them, and they said, that's all very well and good. But unless you show me something that this actually works, I'm not going to bite. So we had no plans to conduct an intervention, but this is what we are doing now, because our proof of concept isn't enough proof for these SME clusters. So we are now building in an intervention where we are actually replacing a 15 kVA generator with an equal like-for-like solar plant, a battery plant, photovoltaic and storage plant, to show them that this can actually be done. This is the demonstration effect that we are talking about. And then once this happens, we can then open this out to the entire cluster, and we can take it to donors and funding agencies and say, look, this is something that you've been grappling with, how to bring power to the SMEs. Well, maybe this is something that you can then scale up because we've built in these mechanisms of horizontal enforcement. So the final stage is actually not just moving to the entire cluster, but moving it Nigeria-wide. And I did talk about scaling in financial sustainability and how is it that we've actually arranged this financial sustainability. Private financing is never available to these kinds of fragile contexts. Whatever we say about challenge funds and green funds, once they come in and look at these clusters, they look at the lack of collateral, they look at they don't have any data with which to work with so that they can de-risk their own model. So what we've done is de-risk this model for them. We've shown them not only are they willing to pay, they're willing to monitor. So we've done this de-risking exercise. We now take this model, and that actually helps crowd in a lot of financiers. And it's also helpful for donors to say, well, some of this legwork has already been done. How about taking the leap and then financing this intervention and going forward? So our intervention is actually based on such a model, and it's also one where after 5 years, because it's also based on a kind of subscription fee, the SMEs own the assets. They actually own the plant, so there's credibility being built in a situation where there was very little trust, and trust is at a real deficit in these kinds of fragile situations. So what we try and do is build in trust through this intervention. Again, this wasn't what we intended to do. We're now actually going and looking for funding for this, but without this adaptation in our sort of process, we won't be able to get the buy-in that we are looking for, and will not be able to demonstrate the success. So to conclude quickly, vertical enforcement is itself difficult to enforce in isolation in these kinds of fragile contexts. The power, capabilities, and interest mapping actually allows us to look for horizontal enforcement that may already be working, or in other cases, like in the SME case, identify potential segments of actors where this kind of a solution would actually be in their interest, and then design it and carry it to them and see how that works. The resilience is about building sustainability into governance mechanisms. And, this can only be the case when sufficiently powerful and capable actors. They're powerful because they can horizontally check each other. They're capable because they're already SMEs and producing. So this is the best chance that we will get at adherence in these kinds of fragile and vulnerable contexts. And I just want to conclude with the fact that it might seem like a lot of homework, but certainly not in conflict situations where you need to run faster, but in these kinds of fragile solutions, fragile context, not doing this homework is actually going to be very counterproductive. And I'm going to end here. I'm pretty sure I've run out of time. Thanks for your patience, and here's to questions. Thank you.
Lovely. Thanks so much for your presentation, and Alistair as well. Wanted to thank you both. Just as a quick time check as moderator, my duty is that we've got about 15 minutes. We have a few really pointed, but I think conversation opening questions in the chat, and I wanted to make sure that Alistair and Pallavi saw some of those. And so what I think I'd like to do at this point is just draw your attention to, yep, thanks. One person just gave the clap, and so that's for our presentation. We'll save some more claps for the very end. But I noted that we had a good question or a couple of good questions in the chat, but I also want to see if people would like to also raise questions live. There is the opportunity for you to raise your hand, and I will recognize you as chair, and we can have you open the mic and speak further. But just to sort of frame at the outset, there was a question that Kate Fellenberg asked Alistair that I think to some extent you gave some information on, which is about the no pilot phase approach and what are the implications of that. And I thought you nicely framed the first answer to that, is that if you pilot something and you're in a situation, you are losing the opportunity to save lives that were saved by reductions in infant mortality rates. I think that there was also the question that was raised about development versus security concerns, and how did the team working on this navigate those in the Afghan context. And then there's a question that I think is relevant to lots of our work, particularly in fragile settings. And I wonder if both of you perhaps could think a little bit about this pooled funding idea and the way in which, Pallavi, you spoke a lot about the ways in which one needs to try to build together, different forms of trust. But one of the ways that you can think about building forms of trust is to see whether or not you can have people bring their resources together at once. And then you'll see that Kate also asked a question about whether or not horizontal enforcement is in lots of ways like local peer accountability. So let me go first to Alistair and then to Pallavi, and if others would like to raise their hands to ask further questions, we'll do that. But over to you, Alistair.
Thanks, Rob. On the question of no pilot phase, I mean, the obvious question, the obvious answer to that is delays, delays cost lives. But looking at it more generally, I think it depends a lot on the context, as everything does in fragile environments. And it depends a lot on what is the state of knowledge. How much do we know about what works, what's likely to work, and what doesn't work? I mean, if we don't know much, well, then we may have to do pilots. I think another issue is the speed at which you can effectively roll out a program. I mean, if it's going to be slow starting in any case, you start off doing what you can, and then monitoring very intensively in real time the inputs, outputs, outcomes, etc., and adjust. And in a sense, that is a pilot. It's an ongoing pilot that evolves into something that gets to scale. And I think the adaptive management side of it is extremely important. On the issue of development versus security, well, I mean, in the case of Afghanistan, our view was, well, we will finance activities so wherever there are people willing to implement on the ground, and of course there were times when the NGOs would pull back and say it's just simply too dangerous. But often at the very local level, people do interact with the local community, and very often we found just in visiting places in the country, the local people would say, well, it's just dangerous. We don't think it's wise for you to come, or we will come, or you can come and we will look after you. But I think so there's a lot of technical things. There's a lot of things that can be done about monitoring using remote sensing, time-stamped photographs. There's a whole lot of stuff that's been done since my time on that. But I think the bigger question is, and this is one which a group of us who are doing some right thinking about the response to the Palestinian crisis at the moment. And I was involved in the very first Palestinian program in the 1990s. And I think there are limits to what development can do to enforce security. At the end of the day, security depends on political settlements, it depends on legitimacy, it depends on grievances. And I think the challenge for development actors is how do you communicate this input, that your development interventions are not going to secure peace to the people who have some decision-making capability. And that is extraordinarily difficult, even in bilateral. I've worked inside a OECD government in their development and foreign ministry, and they have very little influence compared to the defense ministry. It wasn't the US, it was somewhere else. And I think that's a huge challenge. But in the case of the Palestinian program, I mean, looking back, we should have said, well, we're just not going to carry on putting money into this when there's no political traction to resolve the issue, which inherently is a political problem. And on the joint funding, I mean, I can't emphasize the benefits of that enough in terms of the Paris Declaration on Aid Effectiveness, all of these principles that have been talked about for decades and not implemented. But this is one way to move towards that. Everybody who's worked in fragile or even non-fragile context knows about the problems of coordination. How do you coordinate? People talk and talk and talk for hours and days and years, and nothing much changes. It's really having a budget constraint, coordinating through the money, pooling the money, and using that as a lever to force priority setting and decisions, I think is incredibly important. Thanks, Rob.
Thanks, Alistair. And a couple of questions about that sort of pooling of funds and why it doesn't happen more often. But I wanted to make sure that Pallavi had the chance to speak a little bit to this idea about, it's not quite a terminology question, but horizontal accountability, and your own thoughts on that.
No, absolutely. It is quite a relevant question in this context. And the way I would answer it is whether you're looking for transparency or accountability reforms, you're still looking at a situation where there has to be relatively better rule of law. And in most of the contexts that we are talking about, and what are accountability processes? There could be actions against corrupt agents, it's better incentives for compliance. But when we have a situation where there is rule by law or selective enforcement, and this is definitely the case in fragile contexts, then what tends to happen is these kinds of accountability processes or accountability policies don't get implemented. Or get implemented very selectively, in which case we have, an even worse problem. So what we are talking about is not so much peer-to-peer accountability, but peer-to-peer enforcement. And it could be of accountability mechanisms, but without getting that peer-to-peer mechanism, enforcement mechanism running, we are not. So this is a step, an intermediate step, before you get to how well you run those processes. So it's much more about horizontal enforcement within that community, like in this case, the SMEs, checking each other. So it's more a checking function, which could be an accountability function, but it's not so much in terms of accountability that we normally think of, but more in terms of enforcement. I'm not sure if that answered your question, but that's how I would see it.
Thanks for that. And I wanted to ask Pallavi, I mean, I know the PCI framework that you've been working with, and if there are any of the ways in which that PCI framework, are there sort of lessons to practitioners that you can pass on? Because I think understanding those incentives, understanding the power, understanding the competencies are absolutely essential to making things work in any setting, fragile or otherwise, and to scale things up. But it also takes a ton of effort and time and subtlety. And I wanted to see whether or not you have some guidance to those of us who are also trying to use that framework, but sort of guides to the practitioner about how to do that well or with care.
Yeah, I might as well do a little bit of marketing here. We've actually been working on a product, a proper product that makes this more accessible. I'd hate to call it a toolkit, but I'd say it's accessible PCI, where we've tried to do what's in our head, with my colleague Mushtaq Khan, what's in our head to actually put it down on paper in a step-by-step fashion with diagrams. And because we know actor-based mapping loves diagrams. So one way of making this more accessible, I think, is in the future, breaking down the thought process behind the identification. I glossed over about 2 years of work when I said we moved from the national grid right down to the SME. But I think the trick of it also is that you work with very embedded and political economy savvy local partners. We need to have country context, of course, but it's also having those kinds of politically smart country partners who might not have the framework, but know the answers to the questions that you're asking. And then it's a very symbiotic relationship. And then that's possibly one way of operationalizing what we are thinking. It's actually, like I said, we're very tuned to thinking about, let's find the rule breakers. If you just flip it, you're finding the rule followers. And it's not something that we tend to look at when we're looking at corruption and anti-corruption, but it's a bit of a mindset change. But if you start asking a different kind of question, you can come up with the answers, I think, with the nuances. But yes, there will be that accessible piece we're hoping very soon.
Oh, thanks. And I didn't quite realize I was setting you up for that piece of marketing, but I'm glad that I did. So I, mindful of time and trying to take seriously my role of moderator, I am aware that we are coming to the end of our appointed time, and just wanted to use the opportunity to do a couple of things. I will not try to summarize the rich presentations that Alistair has given us and Pallavi have given us on Afghanistan and on Nigeria, respectively. I think that one of the pieces that I enjoy most about these conversations and the way this community of practice operates is it gives an opportunity for practitioners and researchers to come who are working on different contexts but trying to address similar challenges can come together and think and talk about the ways that those challenges can be addressed, have been addressed, and looking at a couple of successes, but also some frameworks for thinking about what those successes are. Is always very important. I think that a couple of quick underlines, which that I took from this, was that obviously whenever one's thinking about political economy, it's really vital to take careful account of the stakeholders and their interests. And I think that in both of the settings, I outlined those stakeholders and the sort of different ways that those stakeholders came together to be in support of this activity or to keep track of what was happening in this setting to work well and closely with those stakeholders or to try to align with their interests. I also think it was important to identify local actors, and one of the things that both of you spoke of was that the identification of those local actors and making sure that you work with care with those local actors and give them space to do what they are able to or operate towards a sort of results-driven objective, I think is a crucial piece of this, but also to have systems to hold them to account and to make sure that those political economy elements are in place to make sure that those systems are that the rule of law or the objectives that were put in place made some good sense. I just wanted to note and to end with a couple of quick logistics or summary points. As those of you who are part of this and have registered for it are aware, this is one of a long-standing 8-year annual forum that the Scaling Up Community of Practice has operated, and that community of practice has over 4,000 members. I noted that there were a very large number of people who registered for this event and about 45 to 50 who joined this particular event. I want to advertise as a piece of marketing that there are several event sessions, 12 sessions overall, and on March 26th we'll have a forum a plenary that will bring together the findings of each of those events, and look forward to having those of you who join this session join that plenary and think a little bit about some of the lessons we can take from this particular working group. And I urge you, of course, to keep involved in this working group on fragile states that I share with Pallavi and Jonathan. But also if you would like more information about that forum overall, please visit the Scaling Community of Practice website that I put on the that I put in the chat, and you'll see that there's more information, and thank you, Jonathan, for doing that, on how to register for these Community of Practice annual meetings. So with that, I think all that remains to me is to start the applause, and if those can in the chat can also join the applause virtually for our two presenters, Alistair and Pallavi. Really appreciate your presentations and the insights that you were able to bring. Thanks, and have a great day.